Welcome to Mrs. Anderson's Nutrition and a special edition of the Nutrition Through the Ages series. In this video, we will look at disordered eating and eating disorders. Adolescence is a notorious jumping off point for disordered eating behaviors as it is marked by change, physical, emotional, and social. Body image concerns can become deeply embedded and potentially dangerous at this time. But disordered eating and eating disorders are not just about eating and the foods that are eaten. The National Institute of Mental Health defines eating disorders as serious, biologically influenced medical illnesses marked by disturbances to one's eating behaviors. And research indicates that 1 in 5 adolescents experience a diagnosable mental health disorder, and with that, depression, anxiety, and mood behavioral disorders are among the leading causes of illnesses and disability among adolescents. Also, it is important I mention that eating disorders can affect people of all ages, racial, ethnic backgrounds, body weights, and genders. The terms disordered eating and eating disorders are often used interchangeably, but they're not exactly the same. Disordered eating is about describing the behaviors, while eating disorders is the actual diagnosis related to those behaviors. And just because an individual is not diagnosed with an eating disorder does not lessen the impact of the behaviors. Let's look at some common disordered eating behaviors as highlighted by the Academy of Nutrition and Dietetics. Frequent dieting and anxiety associated with specific foods and/or meal skipping. Chronic weight fluctuations. Rigid rituals and routines around food and exercise. Feelings of guilt and shame associated with eating. Preoccupation with food, weight, and body image that negatively impacts quality of life. A feeling of loss of control around food. And using exercise, food restriction, fasting, or purging to make up for eating supposed bad foods. When broken down individually, some of these behaviors may not feel problematic, but in some ways, it's that thinking that allows the behaviors to intensify and domino into others. Individuals may not even realize how much of their lives are consumed by the behaviors. Before we look at specific eating disorders, I want to highlight some important characteristics that may be different or weren't discussed in years previous. And while the focus here is on adolescence, most of these notes are true across the ages. Eating disorders are increasingly recognized across all ethnic groups and in lower socioeconomic settings. Eating disorders can occur in all body sizes, and their presence in larger bodies is increasingly apparent. Increased rates may be found in sexual minority youth, with transgender youth at particular risk. Adolescents with chronic health conditions requiring dietary control, such as diabetes or celiac disease, may be at increased risk. Adolescent athletes may engage in unhealthy weight control behaviors in an attempt to improve performance or achieve a desired body size. And lastly, adolescents may engage in dietary practices that overlap with or disguise eating disorders, such as vegetarianism, veganism, gluten avoidance, and clean eating, etc. Now we're going to look at specific eating disorders, each of which will be characterized using criteria from the DSM-5. Anorexia is largely connected to restrictive eating, food avoidance, and/or excessive exercise, and it can be diagnosed by type, either restrictive or binge purge. Diagnosis criteria includes restricted caloric intake leading to low body weight, intense fear of gaining weight, and altered perception of one's body weight and shape. It is important here to note that anorexia can be fatal due to medical complications from starvation. Bulimia is characterized by recurring episodes of eating unusually large amounts of foods and feeling a lack of control over eating, the binge, which is then followed by some form of compensatory behavior, such as forced vomiting, excessive use of laxatives or diuretics, fasting, and/or excessive exercise, all in an attempt to prevent weight gain. On average, the binge eating and compensatory behaviors occur at least once a week for 3 months. And lastly, an individual's self-value is overly influenced by shape and weight. Binge eating disorder is characterized by repeated episodes of a loss of control with eating without the compensatory behaviors. Binge eating episodes include 3 or more of the following: eating more quickly than normal, eating until uncomfortably full, eating large amounts when not feeling hungry, eating alone out of embarrassment at how much is consumed, and then feeling guilty, disgusted, or depressed after. Avoidant restrictive food intake disorder is characterized by limiting the amount or type of food, but it is not related to a distorted body image or fear of weight gain. With ARFID, there is a lack of interest in eating or food, an avoidance based on sensory quality of food, or a concern over unpleasant consequences of eating. And the eating disturbance cannot be attributed to a coexisting medical condition, other mental disorder, lack of available food, or cultural and religious practices. There is also oftentimes a reliance on nutritional supplements. Treatment for eating disorders will vary based on the type and behaviors associated. Treatment may include therapy, medical care, nutrition counseling, and sometimes medication. Recognizing signs and symptoms and seeking treatment as early as possible increases chance of recovery. And that about does it. Please follow the link in the description below for more information. Thank you so much for watching. Like, share, subscribe, and have a great day.